Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. In this presentation, we are going to look at the echocardiographic color flow spectrum Doppler. There are various types of Dopplers that we use during cardiac ultrasound examination, namely the pulse Doppler, then we have the continuous wave Doppler, then we have the color flow Doppler. So we're going to look at the differences among these three different types of Dopplers. Doppler is basically measuring the velocity of the flow across a channel. As we can see, in a pulse Doppler, we just put a single point of focus to see which direction the blood flow is going. Either if it's going towards the transducer, it produces a positive deflection. If it is going away from the transducer, as in this case, this is again showing a negative deflection. The difference between a pulse Doppler and a continuous wave Doppler is that in a pulse Doppler, it just looks at one point of reference. What is happening exactly at the tip of the mitral valves? In this example, you can see my arrow, green arrow here, and what's happening at this tip, and it ignores all the other velocities in the region. Whereas a continuous wave, which has like a circle here and dots along that, it is showing all the velocity changes along the course of the Doppler wave. And that's why we see this beautiful smooth pattern suggesting mitral regurgitation. And what is color flow Doppler? We have the velocity when the blood is moving from one chamber to the other. The velocity is transmitted into the velocity of the red blood cells is transmitted into the velocity in terms of numbers, like 100 centimeters per second or 200 centimeters per second, and that's what's plotted here. The velocity increase and decrease and boosting with the atrial kick, and this is what is representing how fast the blood is moving across the heart valves. That's the velocity. And it also tells about the direction of the velocity, whether the velocity is coming towards the transducer or whether it is going away from the transducer or it's coming towards the transducer. Whereas the color flow takes these velocity numbers and converts them into color. If it is coming towards the transducer, it is colored red. We'll see in a minute. And if it's going away from the transducer, it is colored blue. However, in patients with normal heart function, the blood flow is very smooth or laminar. Let's go to the next image here. Let's look at the blood flow is very smooth, so it produces a laminar blood flow. That means uniform color change of all the red blood cells going like a train in the same direction without any disturbance, or the turbulence, as we call it, happens in patients with mitral regurgitation or aortic stenosis or aortic regurgitation. So this is the laminar flow. However, if there is a narrowing of the heart valve, let's say for example you have a narrowing of the aortic valve here, then the flow coming from here is going to be smooth, but at the site of narrowing, the velocity increases, and immediately after the valve there is turbulence of blood flow, creating a chaotic flow instead of a laminar flow that we see, which creates this yellow and green and cyan changes depending upon the direction in which the turbulent flow is coming. To explain this in a better way, here's a chart showing, and here we have a normal aortic valve, we have a laminar flow, and if assume this aortic valve here, and the laminar flow, because there's no disturbance to the flow of blood. However, if you have an aortic stenosis with narrowing of the aortic valve, and this jet going through here increases in velocity, and as it increases in velocity and when it goes past the stenosis, again the lumen widens, so it has more space to disperse, creating these circles. These circles are the ones which are represented by these two extremes, the yellow and the green or the cyan colors, creating a mosaic pattern which creates which represents the turbulence. So here we have a smooth velocity, and as the turbulence increases, we have a turbulent velocity. Same thing with the blue here, smooth and turbulent. Also, we have a scale. The scale represents, 69 centimeters per second, the velocity. The velocity on the left side of the heart is higher compared to the velocity on the right side of the heart. So based on all these factors, the color Doppler is extremely useful in not only visualizing the degree of turbulence, valve regurgitation, and also measuring the amount of valve regurgitation based on certain characteristics. So let us look at further and learn more. As again, the simplistic way to say that is, if the blood is flowing towards the transducer, it's going to be a smooth red color. It's blue if it's going away from the transducer. Whenever there is turbulence, we're going to see these extreme colors, namely yellow and green, which are intermixed, creating a mosaic pattern. And this is represented in a different manner. This is a velocity chart which is showing smooth and dull red, whereas variance is the change in the velocity, creating those eddy currents or the turbulence that creates this mosaic pattern. Okay, let's look at some real examples. Now here we have blood moving towards the transducer, producing a smooth red color, and there is some degree of turbulence which is creating this yellow right here in the center, and the blood is moving into the aorta, which is going away from the apex of the heart towards the aortic valve, so it's producing blue. And this blue color may be related to some degree of mitral regurgitation, and this is the left ventricle, this is the left atrium. So the color flow not only gives the direction of the velocity, but also a visualization of how significant the mitral valve or aortic valve pathology is, and the amount of regurgitation that we can actually calculate using this piece of formula. And it's a sort of a complex formula. It looks at this vertex, and you look at the radius of this vertex, and taking this radius we can calculate the amount of mitral regurgitation. And here is a continuous wave Doppler in the same patient, which is more than 4 meters per second. And you can see this turbulence creates a mosaic pattern. It's not a smooth flow like here, and this is typical of aortic regurgitation or mitral regurgitation. And here's another example of a mitral regurgitation. As you can see, there is the neck, then we have the radius, then we have the flow. And sometimes this flow can tell us to how severe the mitral regurgitation is. If it's a small jet, sometimes we can see multiple jets. If it's a small jet, it's a mild regurgitation. If it covers more than half of the left atrium, it may suggest moderate to severe mitral regurgitation. So there are a lot of information. There's a lot of information that we can gather from the color flow Doppler, which we may not be able to appreciate in pulse or continuous wave Doppler. Here's an example of an aortic valve regurgitation. This is a very narrow jet going here, and this is creating this chaotic color formation, and there are actually 2 jets going down here, one in the middle and one towards the aortic root. And this is an example of an aortic regurgitation creating a mosaic pattern with the valve leaking during the ventricular diastole. As we can see, here's the ventricular diastole. We can look at the neck vena contracta, the area through which there is regurgitation. Then we look at the flow convergence right before that, and the jet length, jet width. All of this can give a significant amount of information about how narrow the valve is, what is the regurgitation volume compared to the stroke volume, so we can find out the regurgitant fraction. And also it tells us about the status of the valves based upon the 2D echocardiography or 3D echocardiography. So based on a lot of these factors, a lot of clinical decisions can be made which we may not be able to obtain that kind of information through cardiac catheterization or even, for example, CT or MRI. So color flow Doppler plays a significant role in understanding the pathophysiology and the structural disarray of either mitral regurgitation or aortic regurgitation. And here's an example of a mitral regurgitation. Again, we have the vena contracta, which is fairly large size. Then we have this the cap here, and if you look at the regurgitant volume, and here's the left atrium, it's covering almost more than half of the left atrium. So this is a case of a severe mitral regurgitation. We can actually calculate the real regurgitant volume or the fraction. And here's an example of a four-chamber view looking at the tricuspid valve. We have a narrow jet coming through the middle of the tricuspid valve, and as you can see, this is creating a lot of eddy currents, almost covering most of the right atrium. So that gives us a lot of information about the degree of tricuspid regurgitation and the amount of tricuspid regurgitation we can calculate by using the formula. And here's another example where there's a wide neck here, and we have a turbulent flow which is covering almost 1/3 of the right atrium. And there may also be an interatrial septal defect because we see some wave disturbances going across the atrial septum. So there's a lot of information that can be deducted from the underlying 2D echocardiography, which gives us a structural anatomy, and combine that with this color flow Doppler, we can deduct a lot of factors which are not possible by any other means of diagnostic test. Here's another classic example of a short vena contracta and a very wide jet covering almost the entire left atrium. And here is the velocity which is given here, and this is a variance scale which basically shows like this is a laminar flow and this is a turbulent flow coming towards the transducer. This is a turbulent flow going away from the transducer. All this blue and cyan we see here, and that tells us about the nature of the flow, the direction of the flow, and any turbulence associated with it. Here's another example. As you can see, we're getting more towards cyan. That is showing a regurgitation which is sort of pretty turbulent, and there's a pretty wide neck here. This is across the mitral valve, and you can see there's a velocity. So these are all very important things. Here's another example of mitral regurgitation. Again, we just going through the same thing. As you can see, it covers almost 50% of the left atrium, along with this neck here, and chaotic blood flow in the left atrium, suggestive of moderate to severe mitral regurgitation. Here's an example of an aortic regurgitation. Again, as you can see, the jet, sometimes it just stops right here in a very like a trivial aortic regurgitation, but this is maybe a more moderate aortic regurgitation where the jet is going way towards the left ventricular cavity and apex. So ladies and gentlemen, you have been watching the echocardiographic color flow spectrum, how it relates to the velocity of the blood flow, how it relates to the turbulence of the blood flow across pathological valves, and how we can determine the degree of stenosis or narrowing or degree of regurgitation, the amount of regurgitation volume, and the regurgitant factor, along with the structural changes that we can appreciate on the 2D echocardiography. Thank you so much for watching this presentation. Please do subscribe to our YouTube channel, and I will see you in the next presentation.